that is for sure. People think that if AI comes, we'll lose the job. It will not happen like that. Opportunities will change. So similar thing will happen in medicine also, because I have seen this lot of improvement is taking place. You can have the history of a person with you and everything available in front of you. But as the technology grows, there are threats perceptions also there. If your data leaks, because that is also very, very important. When you're using artificial intelligence, I think data security is also very, very important, and which is a Herculean task for, because you have the data of everyone with you, and if it leaks, you can understand what can happen. So I'm not going in detail of that. So I would like to invite Dr. C. A. Deen Dayal जी. आज डॉक्टर है तो सबका नाम डॉक्टर ही आ रहा है. हो सकता है he can become a doctor. C. A. Deen Dayal जी for a welcome address, please.
थैंक यू डॉक्टर बीबी मावर जी, क्योंकि कल डॉक्टर डे है तो हम सभी कहीं ना कहीं अपनी फील्ड के डॉक्टर हैं. कोई मशीन का डॉक्टर है, आप इंजीनियर हैं तो मशीन के डॉक्टर हैं, मैं चार्ट अकाउंटेंट हूँ तो मैं अकाउंट्स का डॉक्टर हूँ. तो सभी को एक कल जो डॉक्टर डे आ रहा है उसकी बहुत बहुत शुभकामनाएं. और साथ ही बताना चाहता हूँ कि ये जो 1 जुलाई होता है उस दिन 3 प्रोग्राम होते हैं. एक डॉक्टर डे भी होता है, एक सीए डे भी होता है, और एक व्यापारियों के लिए जीएसटी डे भी होता है. तो तीनों के मैं आपको एडवांस में बधाई देना चाहता हूँ. कोई हो सकता है जीएसटी से बहुत लोग परेशान भी हो, लेकिन नो डाउट जो है तो डे ही रहेगा. तो सबसे पहले मैं आप सभी का बहुत बहुत आभार व्यक्त करता हूँ. हमारे इसमें बहुत सारे लोग पार्टिसिपेंट्स हैं, 10-12 पार्टिसिपेंट्स हैं हमारे. एक तो 6 ओएनजीसी से आए हुए हैं. मैडम आप है बंगाल से हैं लेकिन मोबाइल में डायरेक्टर हैं, आप सीपीसी में डायरेक्टर हैं. ऐसे कई लोग हमारे लोग आए हुए हैं, मैं सबका स्वागत करता हूँ. सबसे पहले मैं हमारे चीफ गेस्ट हैं आज के डॉक्टर सुभाष सरकार जी. मैं इनको वैसे तो आप मिनिस्टर रहे हैं, यूनियन मिनिस्टर रहे हैं, और हमारे संस्था में जब भी हम इनको याद करते हैं डॉक्टर साहब हमें बड़ा आशीर्वाद भी देते हैं और हमेशा कार्यक्रम में आते हैं. तो मैं उनको अपना एक तरह का पैटर्न मांगता हूँ, सीएसआर रिसर्च फाउंडेशन के हमारे पैटर्न भी मानता हूँ. और अभी भी डॉक्टर साहब ने, मैं गया उनके पास मिलने के लिए, मैंने कहा डॉक्टर साहब ऐसे एक प्रोग्राम कर रहे हैं सीए डे का. तो बोले यार मैं बंगाल में रहूँगा लेकिन इस प्रोग्राम में जरूर आऊँगा, क्योंकि मेरा सीएसआर रिसर्च फाउंडेशन से थोड़ा लगाव बहुत ज़्यादा लगा रहता है. तो मैं एक बार जोरदार तालियों से डॉक्टर साहब का स्वागत करें, डॉक्टर सुभाष सरकार जी का. साथ ही साथ हमारे बीच में आज गेस्ट ऑफ ऑनर के रूप में हैं श्री पीके सिंह जी. आप एग्रीकल्चरल कमिश्नर हैं मिनिस्ट्री ऑफ एग्रीकल्चर में. मैंने भी भाई साहब से कहा था कि ऐसे हम भी कार्यक्रम करना चाहते हैं, तो बोले मेरा क्या रोल रहेगा इसमें भाई, आईटी ये एआई जो है टॉपिक हेल्थ केयर. तो मैंने कोई बात नहीं, आप फसल की भी कहीं ना कहीं डॉक्टरी करते हैं कोई फसल की आप डॉक्टर हैं. तो मेरी बोले कि चलो मैं आऊँगा, जो भी मैं 5-10 मिनट बोलूँगा मैं आपको बताऊँगा क्या क्या है एआई का. तो मैं डॉक्टर पीके सिंह का जी का भी बहुत आभार व्यक्त करता हूँ. डॉक्टर एसके वासले जी आज के हमारे एक स्पेशल एड्रेस के लिए मैंने कहा था सर आप स्पेशल एड्रेस दिए, तो मैं उनका भी बहुत बहुत स्वागत करता हूँ सीएसआर रिसर्च फाउंडेशन की तरफ से. और नो डाउट इस प्रोग्राम को डिजाइन करने में जिन्होंने बड़ी मेहनत की है, और कहते नहीं जो एक कार्यक्रम की जो एक हार्ट होता है वो डॉक्टर प्रियस मेहरा जी हैं, जो अभी कंसेप्ट नोट के बारे में बताएंगे आपको. मैं उनका बहुत बहुत आभार व्यक्त करता हूँ कि उन्होंने इस कार्यक्रम को डिजाइन भी किया, कंसेप्टली इसको मतलब डेवलप भी किया, और आप लोगों को बुलाने का माध्यम कर देंगे. तो डॉक्टर प्रियस मेहरा जी, मैं इनके लिए बहुत जोरदार तालियों से स्वागत करा. और हमारे बीच में मुनीश गुप्ता जी हैं, प्रवीण कांत जी भाई साहब हैं, और नो डाउट हमारे अध्यक्ष श्री बीपी महावर जी. आप पहले डायरेक्टर ओएनजीसी रहे हैं, और मेरा लगाव भाई साहब से बहुत पुराना है. जब भी मुझे दिक्कत होती थी पहले, अब तो डायरेक्टर नहीं रहे, लेकिन अभी भी जब दिक्कत होती है तब भी इनसे कहता हूँ भाई साहब ये काम कराओ मेरा. तो इनके लिए भी मैं बहुत आभार व्यक्त करता हूँ कि मुझे जब भी दिक्कत होती है आप मेरा बहुत पूरा समर्थन भी देते हैं, सहयोग भी करते हैं. एक बार मैं सभी आप जो मंच में बैठे हैं उनका बहुत बहुत आभार व्यक्त करता हूँ. साथ ही साथ हमारे पैनलिस्ट बहुत सारे लोग बैठे हुए हैं इसमें, जो अभी आपको पूरे दिन में बताएंगे. नो डाउट अभी संख्या में हम कम लोग हैं, लेकिन मुझे लगता है कि हमने लगभग 35 से लगभग आसपास पैनलिस्ट लोग रखे हैं, जिनका हम जो उनका जो ज्ञानवर्धन होगा, जो उनको समझाएंगे, हम कोशिश करेंगे वो आपके लिए बहुत बेनिफिशियल होगा. और जो लोग बार-बार से आए हैं, जैसे जो पार्टिसिपेंट हैं, उनको लगता है कुछ ना कुछ इस सेमिनार की सार्थकता मिलेगी। मैं पुनः सभी आप सबका बहुत-बहुत आभार व्यक्त करते हुए और सभी का सम्मान करते हुए और आशा करते हुए कि ये पूरे दिन की सेमिनार कहीं न कहीं आपको फ़ायदा करेगी और जो हमारे स्पॉन्सर भी हैं क्योंकि हर चीज़ में कर्म, धर्म और अर्थ 3 चीज़ ज़रूरत पड़ती है। तो नो डाउट जिन्होंने हमें स्पॉन्सर किया है वो एलआईसी के लोग बैठे हुए हैं। मैं लाइफ इंश्योरेंस कॉर्पोरेशन ऑफ इंडिया का भी आभार व्यक्त करता हूँ। एसएमसी ग्लोबल और यूआरएस के भी लोग हैं और एक दिल्ली दिव्य करके एक वो है मीडिया हाउस, उनका भी बहुत आभार व्यक्त करता हूँ और एमटेक का भी बहुत आभार व्यक्त करता हूँ। बहुत-बहुत धन्यवाद। थैंक यू।
थैंक यू दीनदयाल जी, आपने सबको डॉक्टर बना दिया। अब डॉक्टर सोच रहे हैं हम क्या करेंगे। कभी कभी हो जाता है ना, तो डन पीएचडी दे आर आल्सो डॉक्टर, तो कंफ्यूज हो जाता है कि डॉक्टर है या sometimes a lot of doctors are in the professions which in administrative professions also. When I was in Agartala, some of my this is DMs were doctors. तो मैं उनसे पूछता था भाई आप डॉक्टर एमबीबीएस वाले हैं या डॉक्टर पीएचडी वाले हैं? बोले नहीं, हम एमबीबीएस वाले हैं। तो डॉक्टर्स आर देयर आल्सो, but sometimes they are very very useful in some of the cases. So now I would like to invite Dr. Pravesh Mehra, who has conceptualized this whole concept and what is the theme behind this project. So I'd like him to explain about that.
So good morning, everybody, and thank you so much for joining us in this initiative of AI in healthcare on a Sunday morning. I think from a busy schedule. So it all started, the history started a long time back, not an AI, but association with CSR Research Foundation, which is led by the founder chairman, Mr. Deendayal, C.A. Deendayal Agarwal ji. We were at the Pragati Maidan organizing a camp, you would say, or a screening thing for the Ministry of Health and Family Welfare at the Pragati Maidan grounds. And we used to be there from morning till evening with my team from Lady Harding Medical College, getting patients for oral health screening and one part, and then trying to prevent oral cancer at the second part of it. So our objective was basically defined as preventing oral cancer. We didn't want to see oral health there because, as you know, you're not bothered about your oral health much more than anything about cancer, because cancer hits you in the brain directly. So as oral cancer, what happens is you don't see oral cancer in your oral cavity when it starts, basically. So if I ask anybody how many fingers you have, you would say 10, or say maximum 10 in the feet, so 20. How many ears? 2, because you see them every day, day in and day out. Eyes? 2, because you see them 2, right? Limbs? 2, you know that, 2 or 4. But when you ask any person, how many teeth does he have? I think everybody in the audience would tell us, except our dental colleagues who are there, oral professionals would say 32. 32 दांत होते हैं सबके. It's a myth there. Ideally, yes, 32, but these days, with the evolution of mankind, with the jaws not being used as mastication, because previously we used to eat all raw food. These days, for the past 100 years, everything is on mode of cooked food and the MNC food, which is there, which is all cooked properly, or get into cheese and burgers, everything. So soft. You don't require the chew efficiency. So our jaws are receding. That's the basic idea. When the jaws recede, what happens is this results in impaction of our last wisdom teeth. So you don't have 32, you have basically 28 set of teeth. And then if you go to a dentist in your lifetime, which you would normally do, he removes one tooth or two, so you're left with less than 28. So ideally, only 2% of the human mankind would have 32 set of teeth. Less would have all lesser than 32. So that is what we used to. Our marketing strategy was simple when we went to the Pragati Maidan, that show the people how to come for oral. If I tell a person, come for oral cancer screening, he said, I don't have oral cancer. Mind you, I don't have oral cancer. That's bound to happen. Because he doesn't know that he's got a white patch or a red patch, which would transform into oral cancer. So then we used to count his teeth. We used to tell him, okay, we'll give you a prize, a toothpaste or a toothbrush. You come to us, we'll count your teeth. How many teeth do you have? 32. Okay. So 2% used to give the toothbrush, 20 out of 98 of them used to be screened for oral cancer, 100% used to be oral cancer, where we used to get the exact figures. And mind you, we found around 15% of the screening people used to have some part of lesion, could be a white patch, a red patch, or an ulcer, which they did not know about much. Okay? And we prevented that turning into cancer. Of course, out of 15 that we treated, only 2% transformed to oral cancer, but rest 99% we could prevent oral cancer from forming in. Now, that were human beings. We were 1% screening that. So subsequently, when we started coming back in our domain of Lady Hardinge Medical College, we thought, as one human being or as a professor, I can maximum reach out to 100, 1,000, 10,000 people, not more than that. If I have some machine coming in there and taking a photograph, give it to the patient, let him take a photograph of his oral cavity every day in, day out, and send it to a cloud computing thing, and let that analysis be done by the machine learning part of it, and tell him, yes, you got a white patch, a red patch for this many days. It could be an oral cancer or a pre-cancer lesion. Get back to your medical colleague. I think that would solve the problem in the world around, or in our population of 130, 140 crores of people around. And that is how we communicated with CA, Mr. Deendal Agarwal, where he was trying to put in something of menstrual hygiene there, and we were doing the oral hygiene part, and we collaborated, and subsequently you see the birth of many things around, and this AI in healthcare being the latest that you all are part of. Thank you, sir, for giving us an opportunity. So the concept is simple. What idea was to integrate this engineers, people from IIT, like Dr. Saurabh Ghosh is here, or people from NIC AI division. We have Mr. Madam is there, Samishta Madam, and the colleague is there. So we have integrating them, Chandrakant, into our healthcare system. We work with them. We work with Dr. Saurabh there together to produce this AI development for a simple model of oral health. Now we want to do that on a bigger scale. Okay, so that's the basic idea of doing that. Let's start the ball rolling there. So when we defined healthcare, it basically is to do 4 things which are important. When I as a doctor work around for my patient, it's improve the population health, not one person's health, but the population of the global part or the Indian population, everybody's health improvement. The second is to improve the experience of care. That's very important. Okay, because if you're improving the experience of care, he will not come back to you. And healthcare is not one-day delivery, it's over a period of time delivery. The third is enhance the caregiver experience. So my experience also would depend upon how I get a feedback from the patient. If I try to get a good feedback from my patient, then my experience also would like to go into better healthcare systems, whether I want to evolve something new out of it to deliver to him, which will help his problem in the future time. And of course, cost, reduce the cost, as CA people normally do. We are taking them into to reduce our cost structure, because as I understand, healthcare has to be affordable. Unless it is affordable, there is no use of providing a healthcare to the population, that system of healthcare. So reduction of cost is the most important thing when we try delivery. And when we talk about health, it's also business. Okay, in a government setup also, we're doing a business, because business desires that you use the minimum resources for a maximum of people and derive the maximum benefit out of it. As Richard Branson rightly said, that business opportunities are like buses. You miss them, you have one more coming in. But yes, you have to accept that. Take that bus or wait for a new. So that means you have to evolve yourself, innovate yourselves daily, day in and day out. Unless you innovate, you're not going to deliver the healthcare to the population desired. People from the other industries also have the same thing regarding healthcare approach. So if you look at alphabets, when we were young, we were taught A is for an apple, B is for a ball, and C is for a cat, and D for a dog. Is that true? But these days, the children who are coming in the 21st generation, they don't understand A for an apple, the eating one. They understand A is an apple for the phone that is there. The first thing. The B for not for a ball, a Bluetooth. So they are more internet savvy, you see. They are very internet savvy compared to us. They grasp it very fast. So when you talk about the scientific world, we want to create a flawless model that mimics the human brain, because everything can be developed till now except the human brain, which you're trying to module to a machine. And that is what artificial intelligence is all about, to simulate the brain of the human mankind into a machine there. because that is going to provide us the artificial intelligence and we can work around. John McCarthy has given the term machine intelligence, and he's applied the computer science to know about artificial intelligence. The fourth industrial revolution has rightly changed the scenario of any industry. And I understand healthcare also is an industry there. It's an industry, there's no doubt. The first industry that came into was the agriculture. So before the first industry came, it was all agriculture derived. Okay, so normally when industry comes in, you have a product they produced. But healthcare, you don't have a product there, you have a service delivered. Now, there's a vast difference between what is a product and what is a service. But the main difference being is a product can be inventorized, it can be produced and kept and desired whenever you want. A service, a medical service especially, cannot be done like that. It has to be consumed immediately. The time it is produced on the OT table, it is consumed immediately by the consumer, the patient there. So that's the most important. We need to understand that. As far as healthcare industry goes, right, hospital is just a part of it. It's basically pharmaceuticals, the medical education part, medical technology coming in a major way. You have traditional complementary medicine, so Ayush in a major way, consulting services, your healthcare financing, your healthcare facilities, and medical devices and drugs and everything. So besides this, insurance is also a major part of it, the healthcare industry. So when we talk about the fourth revolution or industrial revolution, we start on the first industrial revolution, and that was the first industrial revolution was given by steam. Okay, we had the steam engines produced. The second came by electrical, so everything motors had come in. The third came with the computers, the basic computing of it. But the fourth is going to be the more variety or the integration of computers into anything else, and that's going to be faster. Okay, but the difference lies is you can't compare a human being to a machine. You might put the artificial intelligence there. What we did is, if you see, initially we had the typewriter, we used to type around. Okay, when I was doing my thesis back in '96, we had an electronic typewriter where you type one line and the second line it could not correct itself. By 2000, we had ordered to MS Word. Okay, then came into MS Word 6, 7, 8, 9, 10 came in. So that was one software which came in, right? So, but in a human thing, he can do multitask at the same time. Okay, he can write an article, he can publish a book, he can see a patient. The computer will only do one job at a time. You might increase his efficiency, the computational part of it, but the variety of work will remain one only. It will not be multiple. So you'll have multiple machines coming in there doing the one person's job, ideally. So that is what is going to transform our healthcare system also in the few years. But will AI replace doctors, especially radiodiagnostics, or could be surgeons? I don't think so. It will make the life of medical colleagues very easier with the future coming in. What are the types of AI in healthcare? We'll have various people talking about it, especially robotic surgeons being there. We have AIMS professor coming in. Then we have the machine learning part will be taken by CSR people. We'll have people from NICA division coming in. They would be taking the AI division of how we integrated with the NIC division of producing an IVRS helpline. Now, it was simple. I used to my OPD and people used to come day in and day out asking for prevention. Talked, how do I clean my teeth? How do I oral hygiene? How do, my gums are bleeding? Simple things. I, as a manpower which is highly trained for maxillofacial surgery, was devoting 50% of time for doing routine works. And that is what I thought with my NIC colleague. I've lost him, my friend, dear friend. I have my dear friend coming in, Mr. John Phillips, who lost during COVID times. He was there and we sat in the OPD, thought, what about it? He said, why don't we put an IVRS helpline? So we recorded something, and that line was devoted to the government. It was inaugurated, I'll show you, by the Minister of Health there. But the data is the main thing, the electronic health records in our systems. And the 10 promising applications in healthcare, this is going to transform the healthcare in the future. Whether it be diagnosis, to treat patients, to develop any molecules, or in monitor patients, everything is required in the healthcare system there. So you have assistance to consumers. But when you talk about learning or a cat there, how do you teach a system or a computer to diagnose that this is a cat there? There are various systems which you learn around as the session progresses. This is the inauguration happening. I was talking with the IVRS helpline 1800112032 of an IVRS, which was the first thing that we inaugurated 2017, way back 7 years now. Biometrics for age determination, because we are determining age of children, of convicts there, and human mankind could produce errors. We can have AI coming in a major way there. So that is our experience with COVID times. We developed the helpline, and that was basically Vadyavani application of helpline, which was started there. Various applications into medicine. You can see that from, I said, diagnosis of oral cancer or pre-cancer. You could have a simple camera doing that work there, or diagnosing age, or surgeries, orthodontic surgeries. You could have systems telling into place where your cuts are to be made, how is to be made. The big concept coming in, where the OPMD hub was at Lady Hardinge Medical College in the Government of India, and it was made as a PMD hub for the Government of India National Resource Center on oral cancer or oral pre-cancer there. Because people come with OSMF, submucous fibrosis, and they don't know. They're suffering with that. So if you got a simple molecule or a simple camera, you could do that work at the patient's bedside or the house only. So this is again, long time back, Leaford was the person who classified these fractures there. Leaford 1, 2, 3. Medical colleagues would know, other people would wonder what is it. What he used to do, he used to let a brick fall from the height of the cadaver, the anatomy block there, and it used to fall, and he should diagnose these are the fractures occurring. So this could be modulated on a machine. Why do you want to do it on a skull or somebody? It could be done by a machine. Machine application in craniofacial surgery. That's what we're going to hear from our medical colleagues there. Processes of producing CAD-CAM. You see, you require specialized, custom-made, delivered, could be reconstructing jaws, could be reconstructing teeth, could be reconstructing implants. Anything has to be custom-made, delivered precisely for that patient. Application of pharmacovigilance, where you need to have a vigilance regarding drugs and materials. So world will change, and we are the ones who will do that in the future, because that is going to make the difference. I'll show you what we used to do a long time back with a patient with post-traumatic deformity. We used to take his impressions there, carve out, plan the surgery, duplicate on the patient, and operate him. Okay, and that's the result was to get there. That's the result. But these days, with computers coming in, a simple scan of the patient could be done, and we could plan the surgery and show the patient immediately that this is a result that you would get at the end of the surgery. So there are various applications there, but challenges remain. It should be, because it's an integrated approach between doctors, between engineers, between government, between the insurance. Everything has to be integrated. This slide I wanted to show you about Dr. Harshvardhan. When he was a health minister, he said around 10 years back that AI will be used in public health, and that is what the future about the health is there in the country. So with that, I think we'll come to advantage, disadvantage, challenges, everybody. But the main thing lies with patient compliance, because if to produce better results, you should have better compliance and better data, because unless you have that data, you cannot produce anything by a machine. To conclude, I would only say that the future belongs to AI, and people matter to us, because we are looking at the outcome of patient healthcare system. Thank you so much for giving me a patient hearing. Thank you.
Just for 2 minutes, you have to start. Apart from this, we are just looking at what our PM is saying in the Man Ki Baat, just for 2 minutes, and then we'll again come to our business. Can you start, please?
अच्छा, क्योंकि हमने ये इसीलिए दिखाया कि जो टेक्नोलॉजी है, टेक्नोलॉजी के साथ-साथ हमें कम से कम प्लांट के बारे में सोचना चाहिए, धरती माँ के बारे में सोचना चाहिए, इसलिए हमने 2 मिनट का एक वीडियो दिखाया था। नाउ आई रिक्वेस्ट महावर जी प्रोसीड फर्दर।
Thank you, Dr. Pravesh. Good insight, excellent presentation as usual. He's a master of presentation, speaks very authoritatively. बहुत अच्छे से बोलते हैं बड़ी चीजों